Well, it's a parent's worst nightmare, a medical emergency with your child that's so dire you need to perform CPR. So it's best to be prepared just in case it does happen. And with us this morning is Dr. Jennifer Arnold. She's medical director of simulation at Johns Hopkins All Children's Hospital in St. Petersburg, Florida. And Jim Arquetto, right? I got that?
Correct.
Okay, great. And you are the maker of the simulator here.
Right.
First, explain what this is all about. This looks so real.
Well, this is all about healthcare simulation, and we're in Los Angeles this week because we have our biggest national and international meeting for healthcare simulation, and it's really all about training doctors, nurses, respiratory therapists, and even patients and parents on how to save a life, how to handle a medical emergency.
You've got to be ready for that because they're just so delicate and precious, right? And so we've
Yes.
got, I mean, this definitely looks so real. You're here for this big meeting, lots of people from all over the world, I'm sure.
Absolutely.
Okay, great. Well, let's get started. What are we talking about here?
Well, you know, what we're talking about is this is a baby, very high tech. She can breathe, she can turn blue, she cries, she can move, and this allows a healthcare team to care for a simulated patient as they would a real patient.
Right,
And
okay.
it allows us to practice. If you can imagine, you know, I learned how to do a lot of life-saving procedures for the first time on a real baby. Imagine how scary that was.
That was so scary.
So now that we have this great technology with these simulators, we can actually practice life-saving skills, whether it's teamwork and communication or actually how to do CPR on simulated patients so that we don't put any real babies at risk.
Right.
And you know, we all have to practice skills every day, right? I don't know. Have you ever been CPR trained?
I have, yes.
Excellent.
For people and dogs, but
excellent.
never infants.
Never infants.
So
Well,
this is new for me, and
this
it's
is
so
important.
important.
You never know when you might have to save a
It's
life,
so true.
whether it's a baby or a dog.
Right. I'll be ready, though. I will be ready. All right, let's do some demonstration if you don't mind. I'd love to see how this all works.
Absolutely. So this is Super Tori. She's one of our infant simulators.
Okay.
And so if she were to be in a situation, like say, you know, you're a parent and your baby is found, you know, unresponsive, not breathing,
Right.
turning blue, that would be an indication that you need to respond.
Okay.
So for infant CPR, you know, the best place to look is the American Heart Association has all the guidelines on what to do and offers training for anybody who wants to learn.
Okay.
But today I'm going to give you just a brief demonstration.
She's turning blue right now.
She's turning blue.
We need
And
to react.
So we need to be worried. Baby, are you okay? So you might just sort of tap her on the shoulder, see if she's breathing, see if she's responsive. If she's not breathing and she becomes limp, then
Check
you
her
have
breathing.
to-
Would it be with under the nose or?
Well, you really don't need to, as a you know, as just a parent or you know a bystander. You don't need to do all that. Just if the baby's unresponsive, it looks dusky, and looks like they're not breathing either adequately or breathing at all, then you want to intervene immediately. You want to assign someone to call 911.
Okay.
So you can
Amy,
get help
call 911.
as soon as possible, and then you want to start actual CPR. So I'm going to show you how to do that.
Okay.
Most important thing is to do is you always want to do CPR on a hard surface. So typically it'd be the floor, so you
Okay,
don't have to worry
sure.
about a baby falling over. But
Right.
for the purposes of today, we'll do it on the table so
Okay.
you can see. You want to start off with chest compressions.
Okay.
And how you do chest compressions on a baby, there are two main ways. One is to take two fingers, about an inch below the nipple line, and go straight down. And
Pretty
it's actually
firm.
pretty firm. And
Can
it's
I try
actually, you want to go down a third of the depth of the entire chest.
Okay.
So that's pretty hard.
Yeah.
And a lot of people, the reason CPR is not done as a bystander, they're afraid to hurt somebody or do something wrong.
True.
It's better to give chest compressions than nothing else. You can really save a life.
Okay.
You know, for adults, 90% of patients that have an out of hospital cardiac arrest, they die because bystanders are afraid to do CPR.
Sure, yeah.
So best thing you can do is to start chest compressions
Okay.
really hard and fast. The rate that you do it is actually the same rhythm as the song Staying Alive.
Oh.
Which is kind of ironic, right?
Okay.
It's all about staying alive. So you
I
go,
better not sing it though. So sing it for me. How does it go?
I'm not a good singer, but
Okay.
but it's about 100 to 120 beats a minute is your goal. So it's staying alive, and go a little harder, a little faster. Staying alive, staying alive. You got it.
Oh, a
And
little-
you can do it with the two-finger method, or if your baby's small enough, I'm going to tell you another way is to do your thumbs wrapped around. Your thumbs on the front, your back of your hands behind you, and that helps you to support. That sometimes we found gives more leverage.
Oh, right.
And you're going to go
Okay.
really hard and fast.
Can I pick her up just real quick? And
Yep. And you can turn her towards you. You can do it from the head or the.
Okay. Just so the people at home can catch
Yeah.
that. Let me turn this right
Yep.
this way here. And
You
so
want
we
to encircle her torso. There
Okay.
you go. Put your thumbs as much as you
Together.
can straight down if you can, and push down hard and fast.
staying alive, right? We've got that.
Bum, Boom.
Oh, I can feel her. She's breathing.
She's breathing. Well, she shouldn't be breathing.
Well, she's not breathing yet, but I feel some movement. I feel some movement.
Oh, she's coming back. So there you go. So you've saved a life. Okay. So with the baby, though, they actually is a little bit different than adults in that we really do recommend giving a little bit of mouth to mouth.
Okay.
And so you give 30 chest compressions and then 2 breaths by mouth. 30 chest compressions, 2 breaths. And that's because infants, a lot of time the cause of their arrest is not necessarily cardiac, it's more likely to be respiratory. So we do both in the infant CPR, babies less than a year of age.
And the breath would be?
So you want to hold the head in a little bit of a sniffing position, give a little bit of a head tilt.
Okay.
And you can close the nose, or you can put your mouth over the whole nose and mouth.
And then just blow in?
And then blow in until you see the chest rise.
Okay.
And that's how you know you've given adequate breath.
Okay, great.
And just
Twice.
2 of those.
Two
and
of
then
those,
back to
30.
the chest compressions.
Okay.
30 to 2.
30 and 2, 30 and 2. We'll just pretend that's my age, but it's not.
Me too.
30 and 2, right?
Yes.
Okay, great. So I just did the 30, and then we got a little.
2 mouth. Yep, 2 breaths. 1, 2. And then go back to your chest compressions.
And then back to 30, and I can do this.
And you keep going until help arrives.
Wow, this is amazing. This is fantastic. Thanks so much, Dr. Jennifer Arnold. You've really helped us out, and this will be helping so many people. You always want to be prepared as well with this.
Yes.
Thank you for coming in.
Well, thank you for having us. I mean, the Society for Simulation Healthcare is a big organization, and the fact that we have thousands of people together to learn how to do this all across the world
Saving
is
lives.
pretty great.
Thank you so much, both of you, for coming in. We appreciate it. We'll be right back.